Assalamualaikum and a very good morning to Dr. Awad. So my name is Wano Alia Adani binti Mustafa. So today I will be presenting about the assignment titled Understanding How Medicines Are Used, which covers the medication utilization patterns, ATC, DDD system, and patient medication behaviors. So let's begin. So first, what is exactly drug utilization study or DUS? So in simple words, DUS look at how medicines are prescribed, how they are given out by the pharmacy, and how patients actually use them. So according to WHO, it also includes how drugs are marketed and their social, medical, and economic effects. So basically, DUS help us to see what is happening in the real life, not just what is written in the guidelines. So why do we need to study these patterns? Because it helps us to make sure that medicines are used safely and correctly. For example, we can detect things like overuse, such as giving too many antibiotics that can cause resistance in the future, and also underuse, like patients skipping the chronic medications, and also misuse, like wrong drug or wrong dose. And by studying this pattern, we can support the rational drug use, prevent the unnecessary side effects, and reduce the cost for both patients and the healthcare system. Okay, next let me explain what is drug utilization review or DUR. So DUR, it is basically a quality check to make sure the medicines are used safely and correctly. So through DUR, pharmacists and doctors will check if the medicine, the dose, and the duration are appropriate for the patient. So this will help to prevent things like wrong dose, drug interactions, or unnecessary medication. So in its very simple terms, you are make sure that the patient get the right medicines in the safest way possible. So there are three types of DUR. So the first one is the prospective DUR, which is done before dispensing. So pharmacists will review the prescription before the patient receives the medication. So they will check the things like wrong dose or if the patient has any allergy, and also if there is the drug interaction between all those drugs. And the second one is the concurrent DUR, which is done while during the therapy. So this helps to monitor their progress and make sure that the treatment is still suitable. And it is very common in hospital where patients' conditions change very quickly. And last but not least is the retrospective DUR, which is done after the treatment. So here we review the past prescription to spot any patterns or misuse or errors. So these three types help us to make sure that medicine's use is safe at every stage before, during, and after the treatment. Okay, next is drug utilization evaluation or DUE. So what is DUE? DUE is similar to the DUR but more focused and targeted review. So it look at the specific drug or patient group. So for example, checking whether the patient on vancomycin get proper kidney monitoring, because as we all know, vancomycin got effect on kidney. So DUE will help us to improve the quality of care, reduce the errors, and prevent the adverse drug reactions. Okay, so here is the importance of DUR and DUE. The first one is it helps us to promote the rational drug use, like right dose, right drug, duration, and lower the cost to the patient and community. And also, DUR and DUE helps to improve the patient safety and prevent the medication waste and unnecessary spending. And also, DUR and DUE also supported by MOH. And most of the hospital in Malaysia, they perform the regular DUE. And by doing this, it helps to update clinical guidelines, formularies, and prescriber practices. Okay, now let's look at the ATC/DDD classification system. So the first one is ATC. So ATC stands for the Anatomical Therapeutic Chemical Classification. So it is developed by the WHO. And basically, this system, it helps to classify the medicines based on the organ that they add on and their therapeutic purpose and also their chemical structure. So for example here, they use 5-level coding system. So the ATC code for olanzapine is N05AH03. So all of these words have their own meaning. So for example, N is the nervous system, O5 is psycholeptics, AH is antipsychotics, and 03 is the type of medication itself, which is olanzapine. Okay, so now I want to explain the second part of ATC-DD system, which is defined dose or DDD. So basically, DDD is the average maintenance dose for an adult when the medicine is used for its main indication. So in other words, it is a standard dose that WHO used to measure and compare the drug use. It doesn't mean every patient must take this dose. It is just a global reference. So for example here, the olanzapine, the DDD is 10 mg. So this means that when researchers calculate olanzapine usage, they convert everything to this standard 10 mg unit. So even if the hospital use different tablet strength like 5 mg or 20 mg. So why is this very useful? Because different hospitals and countries they use different brands, different doses, and different strengths. So if we measure the drug using DDT, everything becomes standardized. Then we can compare medication use between hospitals, states, and even between the countries. So this system is extremely useful to detect the overuse, underuse, or unusual prescribed strength. So for example here, if one hospital they use a very high amount of olanzapine compared to the national average, so the ATC-DDD data will immediately show that the consumption is higher than expected. So this can signal possible issues like overprescribing, incorrect dose, inappropriate use, or even medication misuse. And in Malaysia, MOH they use this system to monitor the drug trends for chronic diseases like diabetes and hypertension and also mental health medications. The data is then used to decide the formularies, update the guidelines, and also plan the budget. So overall, DDD make the drug measurement more accurate, while ATC make classification more organized. And together, this system will give a clear and standard way to understand how medicines are being used in any country or healthcare system. Okay, so next I'm going to explain three very important patient behaviors that affect how well medicines work, which are adherence, persistence, and polypharmacy. First is medication adherence. So adherence basically means how well a patient follows the instructions given by the doctor or pharmacist. So this includes taking the right dose at the right time and for the right duration. So if a patient doesn't follow the instructions. For example, they skip the doses, take it at the wrong time, or completely forgot. So this is called poor adherence. And this can cause big problems, especially for the chronic disease like hypertension, diabetes, or mental health condition like schizo. Even the best medicine cannot work if the patient doesn't take it properly. And the second one is the medication persistence. Persistence is slightly different from adherence. So persistent, they look at how long a patient continue taking their medication. For example, some patients may start a medication but stop very early because they feel better or they get side effects or they just simply lost the motivation. So persistent helps us to see whether the patients continue their treatment until they are supposed to. And researchers usually measure this by looking at how long it takes between the first refill and the last refill. And lastly, we have polypharmacy. So polypharmacy means a patient is taking five or more medicines at the same time. So this is very common in elderly patients or patients with multiple health problems. But the issue here is when patients take too many medication, the risk of side effects, interactions, confusion, and non-adherence become very high. For example, a patient taking olanzapine together with the antidepressant, sleeping pills, and blood pressure medication, they may feel very sedated or experience the metabolic problem. So by reassessing these three, healthcare professionals can understand what challenges that patients are facing with their medicines. So last but not least, I'd like to conclude everything that we have discussed today. So overall, medication utilization studies are very important because they help us to understand how the medicines are actually used in this real world, not just what is written in the guidelines. So they show us whether the medicines are being used properly, whether there are any problems, and where we can improve. So tools like DUR and DUE help us to detect the inappropriate prescribing, for example, wrong doses, unsafe drug combinations, or unnecessary medicines. Meanwhile, the system like ETC and DDD help us to measure and compare the medication used across the hospital or even countries. So this system make it easier to identify the overuse or underuse of certain drugs. But beside the system level data, we also need to look at the patient side. That's where the adherence, persistence, and polypharmacy came in. So these behaviors tell us how patients are actually taking their medicines. Even the most effective medication won't work if the patient doesn't take it correctly or if they are taking too many medication at one time. So the big picture here is to make medication use safe and effective, we must look at both sides, the healthcare system and the patient behavior. And finally, the role of the pharmacist is extremely important because pharmacists are the ones who check the prescriptions, prevent the interruptions, educate the patients, and ensure that every medicine is truly needed. So they help to make sure that medicines are used rationally and safely. So in conclusion, the ultimate goal here is simple: to give the right medicines to the right patients at the right time for the right reason. I think that's all from me. Thank you.